My name is Jennifer Ormsby. I'm the Director of Infection Prevention and Control. For all patients and visitors coming in, they're screened on entry. They're asked the 5 cardinal COVID-19 symptoms on arrival, and they are then given an ear loop mask to proceed to their destination. Staff that enter Boston Children's Hospital are screened on arrival. They're asked the same 5 COVID-19 cardinal symptoms, and if they have any of those symptoms, they are asked to leave and cannot work during their shift. At Boston Children's Hospital, we have a universal masking policy, meaning that anybody that enters any of our doors has to wear an ear loop mask at all times except for eating or drinking, or if they're in a conference room or an office by themselves. Therefore, staff, patients, visitors are all expected to wear an ear loop mask at all times. If your child doesn't want to wear a mask, they will be offered a mask on entry and encouraged to wear the mask. But if they really won't wear the mask for whatever reason, they can proceed to their location and then they'll be placed in a single room as soon as possible. And then healthcare providers will wear the appropriate PPE, which is typically an ear loop mask and eye protection if the child will not wear a mask. If a child refuses to switch their mask for whatever reason, they can wear their home mask. But we would like to provide the same protection for everyone within our institution and wear the same ear loop mask. There are many extra cleaning precautions being done throughout the institution. We've increased the cleaning frequency of public spaces, which includes bathrooms and waiting rooms. Additionally, staff members across the institution are cleaning high-touch surfaces more frequently. That could be keyboards, mouses, handrails, chairs, armrests. All those things are being cleaned more frequently. There is hand sanitizer available in all areas throughout the institution, and you may be encouraged to perform hand hygiene more frequently as opposed to visits previously. And if you don't see hand hygiene readily available, you can ask a staff member at any time. So social distancing is really important to us. We've implemented many things to encourage social distancing. When you arrive to a clinic space, there are stickers or decals on the floor to encourage people to stay 6 feet apart. We've also created barriers in some waiting rooms to separate people so that they're 6 feet apart. And additionally, we've educated all of our staff on the importance of staying 6 feet apart.